Planned Parenthood is already seeing patients from Texas come to Washington every week. And if Roe v. Wade is overturned, it anticipates even more.
My body, my choice.
In the last month, since a leaked draft opinion from the Supreme Court, rally-goers are fighting for abortion rights.
Now we must work to keep every option on the table.
With a clear message. Since then, Planned Parenthood of Washington has been strategizing how to handle an increase in patients seeking refuge in the state.
We are already seeing patients from Texas, from Oklahoma. I saw a patient a couple of weeks ago from Alabama.
Planned Parenthood of the Great Northwest says it's working to see which locations in Washington could open up for additional days if needed, and upping its patient navigation teams, which help patients with appointments and travel arrangements.
We also ultimately do not know how many people will be coming and from where and what their needs will be.
26 states are likely to have total or near total bans on abortion if Roe is overturned. Idaho's trigger law bans all abortions with exceptions for rape, incest, and if the mother's life is at risk. According to the Guttmacher Institute, a pro-abortion rights think tank, more than 230,000 patients could travel across state lines from Idaho seeking an abortion.
Do you think there's going to be a need for more funding?
Yes, it's a very simple answer. I think that traveling across the country to access medical care is expensive for people.
We asked Governor Jay Inslee's office if there are any plans for more state funding to help with the possible influx of patients. The governor's office said, quote, "We are speaking with legislators and providers about a range of additional policies and resources that would ensure we can provide abortion services to any person seeking them in Washington. Access that Barry believes is a fundamental right."
It feels like a violation of a physician oath to deny this care to people.
Seattle City Council also passed a resolution last month that would allocate funds from its supplemental 2022 budget to expand access to reproductive health care. No exact dollar amount has been given yet, but it will be discussed in committee in July. Reporting live in Seattle, Julie Calhoun, King 5 News.